Thank you so much for joining us today. We're going to get started in just a few minutes here, so stick around. But thanks again for joining. We will start promptly at 1 o'clock.
All right, good afternoon, all of our attendees and panelists. I'm going to wait just about 60 more seconds here before we officially begin, just because I know there were a lot of registrants and I see the participant numbers continuing to rise as people get logged in. So I want to make sure that before I start introducing our lovely panelists today, people have a chance to get settled in. I think that this is going to be a great follow-up from what we did last year. I'm excited. All right. I think that that's my cue to go ahead and get going. It's just a little bit past 1 after. Hello, everybody, and welcome again to our programming today. My name is Luke Wortley. I'm the program director of the Upper Midwest Telehealth Resource Center. We are a grant-funded entity from the Office for the Advancement of Telehealth, housed at the Indiana Rural Health Association. We are essentially your telehealth clearinghouse for the 4 states of Illinois, Indiana, Michigan, and Ohio, providing free technical assistance through all phases of adoption, implementation, innovation, and expansion of telehealth programs, as well as answering any kind of more specific use case related questions, billing and coding concerns, et cetera. And this is part of our outreach efforts for our 4-state region. I have the distinct pleasure of introducing our panelists today, but first I wanted to say that participants are free to use the Q&A function located at the bottom of your screen there. If you do have questions, I don't think I'm going to ask our panelists to stop the flow of the presentation midstream so that they can answer them. So we will actually wait until the very end to take any of those questions and see if there's any more organic discussion at that point. So without further ado, I have the pleasure of introducing Dr. Brenda Huber. Dr. Huber transitioned from her position as a professor in the Department of Psychiatry and Behavioral Sciences at Rush University Medical Center and executive director of Rush Neurobehavioral Center in the spring of 2022 to build a portfolio career under her umbrella business, DocB PLLC. She previously served as the director of psychological services center at Illinois State University and training director of the Illinois School Psychology Internship Consortium. I'm going to let her take it away here because she's also going to introduce one of our other panelists, Terry Murphy. Dr. Huber, go ahead.
Thank you so much, Luke. We really, really appreciate the Upper Midwest Telehealth Resource Center for hosting the webinar today. I'm going to go ahead and share my screen so that
Oh, I do want to say real quick, the organization that also brought all of us together today, I want to thank the Partnership for a Connected Illinois under the leadership of Nancy Kazak and company. Without them, a lot of us wouldn't have met for a wonderfully successful program to be delivered last year. And I'm very excited to see this next year update here.
Thank you, Luke. The Partnership for a Connected Illinois has been the sponsor of all of this work over the last 3 years. The Partnership for a Connected Illinois began, and you can see by the website address Broadband Illinois, began as with broadband dollars perhaps a decade ago, and has taken a huge interest in children's mental health, working to address the needs of young people through digital telehealth practices. So they are a huge, and Nancy Kazak has been a champion for this work. So we're excited to talk to you today, not just about the youth mental health crisis, but using digital mental health resources. And over the last 2 years, we've been working in rural, urban, and suburban schools. And we're excited to give you an update on that. So with me today is my colleague, Terry Murphy, the CEO of Edge Health, and also an adjunct faculty at Cornell University. Terry's expertise is digital tools. So my background is school-based mental health work, and together with Terry, the digital mental health expertise that he brings to this partnership, we're making quite a team, and we've been spending time with school districts and other behavioral health partners around the state for the last 2 to 3 years. And our work has been funded by a number of grant funders. So we want to recognize the VNA Foundation and the Sprague Memorial Institute, primarily for supporting our work in the Chicagoland area. But they're huge supporters of our efforts to address youth mental health needs. The Stone Family Foundation has contributed to our dissemination of our work in the form of these webinars. And we also have grant funding from Blue Cross Blue Shield of Illinois through their Blue Impact program and the Illinois Office of Broadband. So we've been working on this 3-year pilot project, and a huge part of it is to raise awareness about these amazing digital mental health tools that are available in this space. So these are programs that have been designed to be used in schools and hand in glove with the school-based mental health teams in schools to address and promote children's well-being. Our work has been identifying pilots, identifying schools that are interested in trying out a tool in this digital behavioral health space with their students and families. And our goal after doing these implementations in a wide variety of different schools and communities to develop implementation guides so that other schools can more independently implement them. What we found when we started this work is that there we talked to probably 100 different schools in our first year, and only 3 of those had even heard of one of these digital mental health vendors. And so a big part has been to raise awareness What we found were some schools who did know of some type of tool or vendor or app that they were using. Oftentimes things didn't work out well because there were a lot of implementation barriers. And so we've been working with schools to find out what those barriers are and help them overcome them so that we can create these implementation guides. So today we're going to go through the needs, the resources, the barriers, the lessons we've learned so far, some of our outcomes, and where we're heading next. So one of the silver linings of the pandemic was that we recognized a number of things. First and probably foremost, we learned that we were all very interconnected when we went through the pandemic. But specific to this project, it was brought to the fore that there was a huge need to address mental health issues for young people and their parents and adults. There was also a huge need and benefit of good broadband access and digital tools and resources. All of us, flipped to Zoom overnight for our work and began to work from homes and all different other settings. And there were just amazing advances in a short amount of time. Where there was also a recognition that schools are a major provider and a primary source of mental health services for kids. That was true before the pandemic, but now everybody knows it. And so there's a lot of attention and also pressure on schools to address young people's mental health needs. There was a recognition for need for funding, that healthcare services were being delivered in schools. And most schools attempted to either hire their own additional therapists to address individual therapy needs, or they contracted with agencies in their communities. And this really did promote a lot of collaboration across communities. So what we've found over the last couple of years as we've been working in this space is that the mental health needs of young people have improved ever so slightly since around 2022. So things got really bad during the pandemic, and then we've seen young people start to get a little bit better. Whether that's distance from the pandemic itself, or whether it's the infusion of funds or those changes that I just recognized in the previous slide. Children's mental health is slightly ebbing in the right direction. However, not at all at the level of mental well-being that it was prior to the pandemic. So nobody's sort of like back to baseline yet, but there have been some slight gains around sadness and hopelessness and attempts at suicide and suicidal ideation. Specifically, there's this area of hopelessness that folks have been monitoring, like through the CDC and so on, that young people have felt like their future is bleak. That there's not a lot of hope for them to have a home of their own, and to have a career that's going to pay their bills and things like that. There's a lot of concern, and the pandemic just exacerbated all of those things. And so we're seeing a slight rebound, but we're also seeing a whole lot more anxiety and chronic stress. So like when they test the cortisol levels of young people are feeling a lot, essentially having some terror about their own safety in the world right now. And it seems to be not about the pandemic so much as it is that gun violence is gun deaths are the highest cause of death in young people. There are a number school violence. I just heard yesterday that there was a shooting on the campus of my alma mater in the student center yesterday, and these are so common that they barely make the news right now. But young people, it's registering with young people that they're not very safe. And, adolescence in particular is a time of identity development. And so young people, regardless of what their identity is, whether they're LGBTQ, whether they're acknowledging their racial or ethnic identity. It's a very difficult time for them right now in developing their identity and feeling safe in the world. And then there's been a lot of focus about social media, young people themselves acknowledging that social media is harmful for them. Recently, I read 50% of young people recognize that social media is having a harmful impact on their mental well-being. And it can be because of cyberbullying and those kinds of things that we hear a lot about, where peers are victimizing each other over social media. But it can also be other things that, you know, the media itself is causing them to have feelings of hopelessness about the world and those kinds of things because of the way that the algorithms operate. So this coupled then with what's going on in terms of our mental health resources. So we have had ongoing workforce shortages that do not seem to be getting much better. We also have the COVID relief funding cliff. So many schools that did that hiring and contracting for extra mental health providers, many of whom actually couldn't find mental health providers to provide the services, even though they had the money, that money is ending. And then there's a whole new series of cuts and uncertainty around education, mental health, substance abuse research, treatment, and also research programs and funding. So there's some of the data that we follow on the CDC and all those kinds of things. There's funding that's being cut to monitor how young people are doing. So the answer really is to operate within a public health model. So in the schools, you'll hear words like MTSS, a multi-tiered system of support. So the beauty of the public health model, and it really does work when we apply it to a public health issue like children's well-being, we are doing things for all of the students that raise the boat, is the tide that raises the boat for everybody. So the triangle represents all the young people. And so when we're talking throughout today about digital behavioral health tools that target tier 1, we're talking about resources that are for every child to promote their well-being. And then as we go up this triangle, there's a smaller portion of young people that need more than what we're doing for everybody. So that's tier 2. There's a targeted level of intervention for young people that are developing in their development's getting off track, and we need to intervene early. These two levels, tier 1 and tier 2, are the most cost-effective approaches because they make that top of the triangle smaller. In many cases, our triangle isn't even a triangle because when we get up towards the top, it's still fat, right? Like the bottom, we have a lot of kids needing individual therapy and a lot of kids needing this intensive level of support at the top of the triangle. But if we do our tier 1 and tier 2 well, we get a tiny number of kids that are having more frequent or more intense needs. So it's the most cost-effective approach. It reduces the frequency and intensity of disorders. And something a lot of people don't realize, that every child benefits when one child in their system benefits. So if I'm a child in a classroom and someone else in my classroom has a mental health problem, there's a greater likelihood that I'm going to develop a mental health problem. And it's this interconnectedness that we've been talking about, that when one child benefits, the whole class benefits. I'd like to introduce our first panelist, Principal Latia Toombs of Gregory Math and Science Academy here in the Chicago Public Schools. We're going to highlight our implementation at CPS. Even though we're just beginning it, we have been, let's see, our implementation launched on April 1st of this year. So I'm going to stop sharing for just one moment, and hopefully, there we go. I need to pull up my questions for my colleague. So Principal Toombs, thank you so much for being with us and being an early adopter. We have 5 elementary schools in Network 5 of Chicago Public Schools who've opted in to participate in an implementation of digital behavioral health tools. And so the first thing I'd like to invite you to share with us is, can you tell us a little bit about your school, Gregory Math and Science Academy?
Yes, thank you for having me, first of all. Good afternoon, everyone. Gregory Math and Science Academy on the West Side in Chicago, Illinois. Right now, I have about 299 students. My school is a school with a high mobility rate. We have a growing population of STLS students. Those are students in temporary living situations, and a growing population of students with disabilities, students with IEPs and 504 plans. So those are some of our immediate challenges at Gregory. Our numbers, our enrollment numbers, they fluctuate daily because of that mobility rate. But that's where we are at this point in the school year. We serve students from pre-K through 8th grade. So Chicago is a district that still does the kind of K through 8 model for elementary school. There are not very many schools that are split up into middle schools or junior high schools. So we do serve students from pre-K through 8th grade. And I also have 2 cluster programs. Those are significantly modified curriculum programs for students with severe disabilities. So that our 2 cluster programs serve kinder through 2nd, the primary, and then the intermediate is 3rd through 5th.
Wonderful. So you have a wide diversity of student needs in your 299 students right now.
Yeah.
Can you share a little bit about how your students have been doing this year regarding their social and emotional and mental well-being?
So it's been a roller coaster. You mentioned suicidal ideations. We've seen that in some of our students. And when we see that, they are referred to the counselor and social worker. And there is a questionnaire, a checklist that those clinicians follow to determine if these ideations are in fact valid. That questionnaire includes, do students have a plan for carrying this out? Or is it just a thought at this point? And so it's been a roller coaster of things. You also mentioned the social media, and I've really understood for students, especially our 6th, 7th, and 8th graders, social media and text threads are king. And so we've had a lot of instances where students are creating social media accounts and text threads, and they're using these accounts and these threads to bully each other, plan fights and other altercations. So we have to monitor students at various levels here.
Wow. You were one of the first principals to choose to participate in this implementation that we proposed to you earlier this spring. What motivated you to opt in?
So I can't take the credit. Our previous principal, Ms. Danella Carter, she initiated the partnership. And I just came on board, I just accepted the principalship in September. And Ms. Carter really understood the needs of the community. She was in the school for 34 years. And I think at the school level, we have those tier 1 kind of supports and interventions. We have a 2nd step program that all students engage in classes. That is 15 to 30 minutes, ranging from kindness and empathy lessons to problem solving and emotion management. Then we have tier 2 and tier 3 supports. Those targeted supports, small group, one-on-one supports. We have a partnership with Catholic Charities One of their therapists comes once a week to talk to students. She's also available to staff and parents if they choose. And unfortunately in CPS, I don't have a full-time social worker. She's split between my school and another school. So she's also able to provide small group sessions and one-on-one sessions for our students. So parent guidance was a good choice for us because we have students for 7 hours a day. We also have to think about what happens for the other 17 hours a day. And so we want to make sure that parents also are receiving the tools they need to support their children outside of the school environment. And that's why we've selected parent guidance to provide kind of those, from tier 1 to tier 3 supports for our parents so that they have the tools needed to support their students, and then support us. It takes a village, and we want to ensure that students have the supports they need 24 hours a day and not just the 7 days. The 7 hours.
Mm-hmm. What you're describing is something so many schools also share with us, and that is that they're concerned about it. No matter how good the program is that you have, how good your triangle is of multi-tiered supports during the school day, that you're worried about kids outside of the school day and the fact that you can't actually be there for them 24/7. And so having a partnership with a digital telehealth company that can support your families outside of the school day is something that we hear that is a major motivator for people to participate. The other thing that you mentioned is providing the supports directly to parents. And one of the things we're going to talk about as we go along here is what it's like for parents right now, that parents are really struggling to help themselves and then to help their students. There was something else that you said maybe that I'll comment on. I just don't remember what it is right now. I know we've just begun, but do you have any thoughts about the parent guidance, about the resources that have been introduced to the school?
Yes, so I will use a term that one of my bosses uses. We know the school year to go from August through June, but she always says we're really, in fact, because, as school administrators, we're year-round employees, it's really April to March, right? Because our high stakes testing happens in March. So for me, the introducing parents through our Parent Advisory Council and our bilingual advisory committee, we're introducing parents now to parent guidance so that when students return in August, parents are comfortable using the program and the platform. They know how to use it. And so that's where we are now in those planning stages. Our last parent conference day, we had parents come in for a meeting. We were able to provide refreshments so that they could watch the introductory video and give them access to the tools through parent guidance. So just getting parents comfortable. We see that it's important. Parents aren't always available to come into the school, but we know this is 2025. Most of us have these cell phones in our hands daily. And so having a tool that parents and community members and even teachers can access at any point in their day, I think is really helpful and beneficial. And I just want to go back to, you spoke about parents and community members receiving everything from the school. And I think prior to COVID, that's where we were and that's where we were headed. But with the remote work and everyone kind of scattering about and staying in their own corners, I think it's important for us to work to go back to the school is the center of the community and for the community. So what resources can we provide to parents and community members? And how do we make these resources readily and easily available to support the needs of our families and community members?
Really, I do feel like in many communities, this school is a hub, right? It's a hub of resources and community for the folks who live in the neighborhood. I thought of what I wanted to mention, and that was, when we first started talking about these digital tools, I think there were some people who were like, oh, well, will this replace things that we're doing? And we just haven't found that anywhere, that everything that we're doing is at that tier 1 and tier 2 is supporting what you're doing with Second Step, supporting that school social worker who's with you part of the time, supporting your school counselor, and augmenting what they're able to do, because there's plenty of work to go around. And it's somewhat sophisticated, right, to combine what you're doing with Catholic Charities and what your behavioral health team is doing and so on. And so that's what Terry and I are learning about as we work with each school. We're learning more and more about what makes a successful implementation. Principal Toombs, thanks for being on the call. I'm going to shift back to sharing my screen.
Thank you for having me.
Yeah, our pleasure. It's so great to hear directly from you. All right, so there are some barriers for children to receive mental health supports, and Principal Toombs really hit on some of these. One is just that there really isn't enough personnel and psychological bandwidth in the schools to implement these tools. And sometimes it's like even having the help there, it's like, well, how do you get the help? It's like there's got to be a whole plan, right, to get whatever supports and programs you're building to implement them. Even now, but especially right after the pandemic, the people that were on the ground were really putting out fires every day, dealing with whatever the crisis was that came up. And even a lot of schools were asking their Catholic Charities partner or their behavioral health agency to, like, can you just put somebody at our school to help us handle almost like a drop-in, because students were having crises and they needed support in the moment. And so having these tools to add to what was available has been really desirable. Staff turnover is huge. It's not just shortages, but it's the turnover, because folks feel like they're sort of starting over from scratch every time they have turnover. And then student mobility, as Principal Toombs mentioned, and student absenteeism has been an issue all across the country since the pandemic. And so if we're doing these great services inside the school, but kids aren't there, they're not getting those services there either. There's often difficulties partnering with outside agencies because of various funding eligibility, like the young person has to qualify for a diagnosis, for example, before that agency can serve them. And there might be different paperwork and stuff that has to be done in order for them to get services, and that can be a big barrier. And then finally, something that we're going to talk about more is that there is a stigma about mental health services. That's not a big surprise, but we're also finding that there's that same kind of stigma or distrust often about technology in some communities and institutions. And schools are sometimes distrusted, but they often happen to be one of the most trusted institutions in a community. And then the last barrier is just that Illinois is really, really big on local autonomy. So local autonomy for parents, local autonomy for classroom teachers, local autonomy for each building within a school system, and so on. And so having these mental health supports and children actually getting them, sometimes it's a barrier is the buy-in from each of those autonomous systems that children find themselves in. including accessing and getting parent consent. And sometimes it's not that the parent doesn't want their child to get the consent, but there are other barriers such as, getting a signature and that kind of thing. What we'd like to do now is to share an overview of the kinds of digital tools that are available. So we're going to highlight 3 digital tools in our presentation today, but Terry's going to talk about a whole range of tools that we've explored and brought to schools in Illinois.
Good afternoon, everyone. Thrilled to be a part of this. Thank you for joining. What we want to do is first cover the big picture. And as Brenda shared, much of this is driven from this crisis shortage of healthcare professionals. It's cost, it's access. That shortage is not going to go away anytime soon. We know the pipeline is far from adequate, and there's a lot of retirements out of the mental health field. So you're seeing these new solutions emerging. You may have caught wind of a few of these companies. In some cases, it's schools onboarding resources that are digital in nature. In other cases, it's local or even statewide. In the middle, you'll see California mentioned with a couple of the services, and you'll see New York City mentioned in that darker one in the middle. And then on either side, you see a couple of examples of schools onboarding. So yes, these are the kinds of solutions that are emerging. Next slide. And so what we did, again, driven by this shortage, is we said, okay, back to Brenda's point, early intervention, the pyramid, right? What can we do for the lower end, the early intervention upstream resources? What can we do to bolster those? Because in fact, what's happening with such a limited number of social workers, therapists, clinical support, is they're all attending to the top of the pyramid, which in some way, which is critically needed, but in some ways makes the problem worse, because that way we're not doing the early intervention. So Brenda and I, and we mentioned a couple of the supporters, the Sprague Institute and VNA, they supported our effort to research the entire field. This is really one of the only times you'll see the specific. Brenda and I have no affiliation with any of these companies. And there's 16 of them here. Not all of them work directly with K-12 schools. So what we wanted to do is first cast the net broadly and say, what are the companies that are providing digital resources or digital services in the mental health field for youth and or parents? And this is the top of the funnel. These are all the companies that we found. Next slide, please. When we started looking carefully at these companies, we could start to winnow them out. And the first screen out, as you see at the top here, was that we were moving away from pure tier 3, which is teletherapy. There's quite a number of those. In fact, not all on that slide with the logos, there are other companies providing teletherapy for youth. And so that's not a focus of ours. As Brenda said, we're really focused on tier 1, tier 2 early intervention resources. We also started to screen out those that don't support and work with K-12 schools. So there's some of those companies you saw are working through insurance companies, work with employers, are providing services that, yes, are youth mental health and are digital in nature, but not in service and not through school districts. Now, once we got through that, we ended up with about 6 or 7 of those companies you saw. And by the way, if there are companies that you might not have, that you think are in this category of tier 1, tier 2 serving schools that we don't have, we regularly get new information. So we want to know that. So please drop any names into the chat, and we'll continue to check them out. But then we went through a vetting process, and you see 4 areas here. We looked at what services and resources do they provide? And we did a side-by-side comparison. What's their process for onboarding students? What's their business model? What are the costs? What's the profile of the company? And I'm just going to spend a little time on each one, and then we're really going to dig into this number one, tier 1 and tier 2 resources, you see highlighted there in red. But under number one, we're highlighting 2 or 3 groupings. Student-facing resources, first and foremost. Generally, those are for students that are over the age of 13. So think 7th grade. Some of the companies have screening and evaluation as a component. By the way, I want to make sure I say these companies are very different. And it was a bit of a challenge to do a side-by-side because they're doing tier 1 and tier 2 in different ways. So you're going to get a better sense of that on the next couple slides. But some companies are just providing resources to parents. And that particularly is helpful in supporting the younger kids. So, in fact, you heard a company mentioned by Principal Toombs, and that's a company that works with parents directly. And we'll share a little bit more on them in a couple of slides. But there's also some of these companies provide their services to the school staff as well. That's not unusual. Secondly, on the process and onboarding, I won't spend a lot of time here, but they differ in terms of how they do parental consent, opt-in, opt-out, how they enroll students, whether or not they do clinician or coach matching, and how they coordinate, report, and track to the school. Some do a better job than others. The business model, in terms of fees, it varies broadly. Number one, because of that first box, the nature of the services are very different. But as you know, when it comes to tier 3 teletherapy, you can expect clinician type fees that would be in the industry similar to one-on-one therapy, although it's delivered through teletherapy. But when it comes to tier 1 and tier 2, there's different pricing. And in fact, one nugget I can share is when it comes to tier 1 and tier 2 in particular, well, actually both of those, it's generally priced by the size of the student body in the schools. So it's in the case of Principal Toombs, she mentioned 299. That's the number of students she has. There's pricing based on those 299 students. It's then incumbent on the school district to get the most out of that, which means making sure people are using it. Because it's not per student or per parent that uses it, it's based on the 299. And there's differences in billing. What we do to do a side-by-side is we create an example, if there's 500 students, if there's 5,000 students, what would it cost? And sometimes these companies tier the pricing. Again, we're not going into great depth on these 2, 3, and 4, just because it does get into the weeds quite a bit. That's actually what Brenda and I do. We've done this upfront research. If a school is interested in getting tier 1, tier 2 resources that are digital in nature to support their student body, it's a matchmaking process. What are the needs? Which of these companies, because they do things so differently, best meets those needs? And then we do a bit on the company profile side. Some of these, one very important piece, by the way, is that second bullet, because we are finding language is a critical factor. What are the languages covered by the app and the clinicians? What's the diversity, et cetera? Interesting note, again, I'm just referencing a couple slides earlier, that article that was in the middle mentioned 2 companies that are operating in California. California required, I think, 17 different languages, the offering to be available in 17 different languages. So things like that become very important on a specific organization basis. Let's go to the next slide.
Before Terry jumps into, am I muted? Can you hear me?
Oh yeah, we can hear you.
Okay, before you jump into the next slide, I just wanted to mention there were a number of logos on that screen a few slides back, and one of them was for a company that is not included in our side-by-side, and it's because we set those to the side that only did teletherapy. And I just wanted to mention that CPS, Chicago Public Schools, has selected a teletherapy vendor. So the students that we're working with in Principal Toombs School and the other elementary schools, their students have access to a resource for parents, which we're going to talk more about. And then they also have access to a teletherapy provider for one-on-one, diagnosable conditions outside of the school day. And that's a group of vendors that is vast. There are lots and lots of vendors who do just therapy, teletherapy. And so that's not what Terry and I have focused on in this project. We are focusing on these resources that are at tier 1, tier 2, and sort of early tier 3.
Okay, and here's tier 1, just to dig into this a little bit. What I've bolded are the core elements. If I had 30 seconds to explain what is available in terms of tier 1 digital resources, it would be those elements in bold. Individualized content, self-directed, but curated by these vendors, so that students or parents can find their way to asynchronously find their way to something that is very valuable to them at a certain moment in time. And of course, anybody that's in this field understands the value of interactive tools, journaling, activities, exercises that are also made available through those. There's also, in some cases, upfront screening questions. So the app will direct you to those things that fit the needs or interests that are indicated. And then parent topical webinars. We're going to go into this in a little more depth, but this is from the parent guidance resource that Principal Toombs mentioned. But these are interactive sessions that enable through an app, again, all digital, through an app, it enables anonymous participants to interact with the live speaker and post their questions. Not so much like we're doing here in Zoom, but actually they would do those Wordle, not Wordle, what's it called? Word cloud, where people are indicating their highest level, their most significant concerns, and it populates the word cloud as it's just interactive things like that make it a much more compelling and stimulating experience. Let's go to the next one, tier 2. Unless you wanted to comment on any of those, Brenda.
No, that's fine.
Okay. Again, we are generalizing, and just so you realize, not all vendors that offer something in tier 1 offer all of those things. They may only offer one of those. So in tier 2, we're typically talking, and going back to tier 1, that's kind of social emotional learning, self-directed access. Tier 2 is when there's a direct one-on-one interaction typically. And Brenda, I'm quoting from you prior, but in tier 2, you typically the individual is not necessarily diagnosed with an issue. It may be a time-sensitive issue for the student or the parent who's involved on behalf of the student. So there are coaching sessions between 4 and 8, depending on the vendor, 30-minute coaching 30-minute therapist or coach sessions. And the reason that slash is there, one of the vendors, for example, in California, Kuth, in the article talks about this, but they have both therapists and coaches. California contracted for just coaches to interact with and by the way, they have almost 100. This is the state of California, and all students in the state of California, all children in the state of California can use that service. And just in a few months, they've had 100,000 registered and users. That's pretty amazing. And we do hope that we don't know that Illinois has that planned, State of New Jersey, 4 counties are using a similar resource, and that was funded by the state as a pilot. So 4 counties in New Jersey. There are other areas, but generally it's schools that are engaging. These are solution-focused, skill building, evidence-based curricula in those coaching sessions. Now there's one vendor that offers a peer chat forum, which is very interesting. It's not just an open forum, it's pre-moderated, which means as there's a group of folks that have been grouped together by the company based on their needs, issues, topics. And when someone comments to that forum, it's reviewed. It doesn't just end up in the forum, but it's reviewed by a clinician and it's anonymous. So that's a very interesting way to get kids working with each other, helping each other. And then this is a core element to this coach chat. And it's been very popular, either synchronously or asynchronously. Some companies have a 24/7 element to this. Other companies have certain allocated hours for synchronous, but still allow for you to post a chat at 2 in the morning and somebody would answer it the next day. But that's an individual working with the student and by the way, there's also a service that offers this for parents. Moderated asynchronous parent support groups and educator sessions on campus to support topics that are of interest and need at a particular school district. Next slide. So we're very bullish on the opportunity for those tier 1 and tier 2 supports to stem the flood into full-blown crises ending up in tier 3 and tier 4. But when it comes to
Terry, I just wanted to say one more thing about that moderated peer chat group, that tier 2 intervention that I think is really amazing. I just want people to be able to imagine this. So young people who are potentially struggling with a similar need can be in a group with other people who are around their age that are going through the same thing. And then, as Terry mentioned, it's therapist moderated. So every post goes to the therapist, and the therapist reads it before they post it, which is, of course, really important. They know that all of those kids are those kids. The therapist knows their names, but the kids know each other by like a handle or something like that. It's they're anonymous to each other. The therapist knows who they are, and so if the comments and the kinds of things that young person is posting indicate that they need more support than a peer chat group, then that therapist can ensure that follow-up happens. So it's a very unique offering. There's only one vendor that's doing something exactly like that particular thing. And they're using it in a number of, I think, 25 school districts in Pennsylvania or something like that as well. And seeing, young people really like to talk to other young people. And so this being able to have the therapist involved makes it, number one, safe, right? But then number two, they're always monitoring how kids are doing and making sure that if they need more than what they're getting in that particular medium, they can get it. Thanks, Terry.
Yeah, no problem. So back to just to close on tier 1 and tier 2, a number of companies will offer both tier 1 and tier 2. So there's some linkages between that list you saw in tier 1 and tier 2. Occasionally, but it's rarer that that same company will offer tier 3. And but that does exist. Usually these companies, and as Brenda mentioned earlier, there are a lot, this is a lot more common because this is more traditional therapy just via Zoom. Now, in some cases, they have online tools for in-session. That's that second bullet. And there's some clinician preference and matching. So there's some real benefits to the digital aspect of therapy. But like I said, there's a good number of organizations doing this. in some cases, sessions before and after school and on weekends. And there's the app. Some of them have an app to communicate in between sessions for quick check-ins or major issues. Now, I separated this dashboard at the end. That really applies to all the tiers. It's important for schools, certainly, to have a sense of not the name and identity, they can't know that of who's using it, but the number of folks using the resource in general and the different elements of the resource. Next slide. So it's kind of fortunate, go ahead, yeah, there we go, that we were talking about what we were just talking about because, and this is the second version example, or I can't remember if we showed you one. In any case, this is from one of these vendors. And again, we've blacked out the name of the company because we don't want to promote any particular one, but we certainly want to give you examples of what we just showed you and talked through. This is the one that has the peer support. You see in the middle, it says peer support provides safe community spaces. Okay, and this is a group of peers that are talking to each other. Now, the first one, self-therapy, is the tier one. That's the search for information. That's the self-directed search. I have some issues. What are they? And then these are helpful tools or information resources. The middle one we discussed, it's the peer interaction. And finally, you've got that third one, which is the asynchronous drop-in chat interactions with a therapist or a coach. So that is that's a real example of one of the resources that's available. Go ahead, next slide.
That was one, we'll say before we move off of that one, there were several school districts that wanted to go with that vendor, those unique texting and chatting features, but they were being implemented in all of California, all at the same time as we wanted some school districts here to have access. And they didn't actually have a blueprint, a footprint in Illinois yet at that time. They do now. They have, they're working with an insurance company here in the Chicagoland area with about 10,000 students. But we also proposed it with a community in Madison County, the East Alton area, in a grant proposal that wasn't one of ours that happened to be funded. So there is an interest in using that tool here in the state of Illinois, and provided we can secure more grant funding specific to those implementations, we'd like to see that. We'd like to try that out here in Illinois and use that tool. But this is the tool that we're using in the Chicago Public Schools. This has been one that's been selected by numerous schools here in Illinois that has both these interactive webinars that Terry was talking about. And you'll notice there's a social media protecting your child webinar, as well as a bunch of others. And, some people look at this mental health series and think, oh, well, these are all for adolescents, but it actually is not true. These are very appropriate topics for elementary aged students. And we're finding that the content is very relevant to parents of even younger students than you might expect. And then here's the parent coaching that we mentioned, one-on-one video calls with a mental health coach, and then messaging during or in between sessions. And then that coach is able to help connect parents to all kinds of other recorded like videos and resources on a website. Sorry, Terry, was there anything else you want to say on this slide? I feel like I kind of jumped in.
Actually, you did, but it was perfect because my the lawnmowers just arrived outside, so you folks will have to hear the sound of my lawn getting mowed. So
Great.
Great. But you emphasized the key thing. What we do is work with schools, not only just to matchmake, but we hope to help them find the money to fund these things. And that particular, the first one, was not, just to clarify what Brenda said, our proposal did not get funded. Somebody else, and so we weren't able to support that school district from that particular funder.
And I did just want to acknowledge that we are not recommending any of these vendors. We are bringing the vendors that are available in the field to, or in the category, to schools across the state and helping them decide on what will work for them. The reason that many schools are really interested in this one vendor that only works with parents. I also wanted to mention, when Terry went through the tier 1, tier 2, and tier 3, we don't have any vendors in our side by side that just do the tier 3 only, but that tier 3 service is often available for in the programs that have the multiple levels. So that's why we include it here. So the rationale for schools choosing this particular vendor that is a direct-to-parent vendor is partly what the Surgeon General recently highlighted, and that is that parents are really struggling right now, maybe more so than we've known before, with supporting their young people. Their children and adolescents are facing so many things that we never faced when we were their age. And so trying to support them is a major stressor for parents. Also, there's been a bit of politicization of social emotional skill building. So, Principal Toombs talked about Second Step, which is a curriculum that's used all across all the classrooms. And we have social emotional learning standards, which are just skills that our State Board of Education recognizes are skills that are essential to be learners and productive citizens as adults. But there have been sort of a backlash where people have said that anything that has to do with social or emotional skills should be taught by parents. And so there's a lot of emphasis around parental choice in our state. And this kind of goes back to just a general philosophy around local autonomy that we have. And so by being able to put these tools in the hands of the parents, then the parents themselves are choosing what they do and what they use. And then again, that these are available anytime, anywhere for parents. So our urban implementations, we completed an implementation at Distinctive Charter School Network, 9 different schools across the Chicagoland area. And we're working right now with these 5 in Chicago Public Schools. And we've got probably another 5 that are hoping to be able to implement this same tool in the fall. So the tools for the parents are these interactive webinars, the online self-directed courses, and the one-on-one virtual coaching. And so at Distinctive, when we looked at our data, there were 4,700 students in those 9 buildings, and 20% of those students' parents engaged with the website to do some of the self-directed learning. 10% participated in those interactive webinars, and then 1% of parents participated in that one-on-one coaching. And so you can see that this maps on kind of to the public health model, where we had more people using the tier 1, a little bit more using the webinars, and then some additional using the coaching. We surveyed those parents at Distinctive Schools and asked them specifically about each of the different services and how they were, how they perceived those. 100% of the parents surveyed said that the things that they engaged with were either helpful or very helpful. And one of the things that we learned in that implementation is that communicating about these resources to families it's a big deal, right? Just getting the awareness out there. In fact, in the comment fields in the evaluation, the one comment that we got from parents over and over was, we need to get the word out more. Like, parents need to know what is available, because the parents who did participate found it really helpful. And we got this idea of the trusted messenger. So in our implementations where we have seen the most uptake, the most people engaging, are ones that have somebody who's a parent liaison or a multilingual coordinator, or somebody who is a liaison between the school and the parents that parents trust. And so this is one of our big takeaways from our implementation is the communication about what's available, and for there to be a level of trust there. And this goes back to some of the things that we mentioned earlier about stigma about technology, stigma about mental health, stigma about various institutions. Having a trusted messenger can make all the difference.
Before you leave that, Brenda, just one quick add-on. We definitely, back to that slide for a second. We got feedback, though, the fact that the folks at that school district felt like it would have, if it was a full year, it was only a half year, we would have had much more significant engagement. Kind of the awareness was just building. And out of their 7, I think, schools, 2 or 3 of them were new to them, and they didn't have that linkage as strong as they would like in terms of the trusted messenger in those buildings. So those were some.
Yeah, that's a good point. That's a good point. So we've done one, and we're in the process of doing 2 what we're calling suburban implementations. The first one we did was in Glen Ellen, District 41, with 3,500 students. And in that location, we saw that the webinars, the interactive webinars, were the most engaging, the most highly attended, with 12% of their population. And in Bourbonnais School District, where there are a little less than 500 students, and we've been implementing since the end of October, we've had 20% of the families engage with the website, get on the website and research and look at various topics. And we're able to gather data about what topics parents have been interested in, not who looked at those, but what ones were explored. One of the things that we've learned in these suburban implementations is how important it is to have the right people at the table in terms of implementation. So our dream team, when we start with the school, includes somebody who's an administrator, a leader, somebody who has some authority within the school building or the district. The second is to have someone who's closer to families, like an implementer, somebody who has maybe like a school social worker, school counselor, or a parent coordinator, somebody who has more like clinical expertise and buy-in around services directly to students and families. And then somebody who's a communications person, like whoever it is. And in some of these small locations, the communications person is the principal. But there are places where larger districts will have a communications person who does all of the social media, does all the emails home to parents and so on. And then last but not least, somebody who is a parent leader, somebody who's part of the parent advisory council or the PTO or one of those groups, and or somebody who's connected to the multilingual population in the school. And this dream team of individuals seems to be the secret sauce. The other thing is progress monitoring, which just means that meeting happens at a regular cadence and usually closer together at first and then spacing out over the course of an implementation. So maybe weekly right at the beginning to monthly later and so on. And then frequent regular review of the data coming in. So how many people logged on to this thing? And we learn about the communications that are going well and the different techniques to implement. Some schools will do something like a watch party, where they bring, a bunch of parents together to actually engage in a webinar and then talk about it together and so on. So by looking at our data, we can find out what's working. And a lot of people don't collect data until the end of a project. But what we've learned is that frequent, regular review of the data is critical. Now I'd like to introduce Sarah Winkle. So Sarah is the project director of Project Sun, and she's also a parent in this school where we have been implementing Bourbon A School District 53. So Sarah, I'm hoping somebody can pin you. I'm not sure if I know how to do that. Great, thank you. So I have some questions for Sarah, just like I did with Principal Toombs. So I'm going to pull those up. Thank you for being with us today, Sarah. I know you are juggling presenting in another meeting, so thank you for being here. Can you tell us a little bit about your community and your role there?
Yeah, so I am in Kankakee, Illinois. We are about 50 miles south of Chicago. It's city about 60,000 people, but we are surrounded by a couple of, suburbs, I guess, if you want to call them that. Plus, we're very rural as well. So we're kind of a unique space. Brenda comments on how unique we are with our urban, suburban, and rural setting. But we're also close enough to the city, to Chicago, that a lot of our families or people commute to the city, or they leave the city and come down to live in our area because we're just close enough, but we're just also far enough away. So, that's a little bit about where we're at. My organization, Project Sun, mainly works within Kankakee County. So we get to have people from the rural areas come to our city of Kankakee, which is kind of the hub for the doctor's offices, the different services that are needed, that Kankakee, Bradley, Bourbonnais area. And I'm the director of Project Sun, which is an organization that works to bridge the gaps in the behavioral health system for families and children. So we look to see what the issues are with the system of care and try to come up with solutions to fix them, as well as bringing that peer-to-peer piece. So parents who have a child on a mental health journey don't have to walk that path alone. We help connect them with another parent or caregiver who's been there and can walk alongside them, help figure things out. That's a direction that we're headed in as well.
One of the things that I love about Project Sun is the emphasis on parents. So it makes sense to me that this tool that provides supports directly to parents was a good fit for this community's implementation. You've played a central role in bringing these resources to the parents, and I'm wondering, what do you think has been the most successful part of the implementation so far? And what have been your biggest challenges?
I think, although I didn't do a lot of the work, the school district staff did, in communicating with them. I feel like one of the biggest successful pieces you mentioned a little bit earlier was having that core team of people to really help make sure that everything is done properly, communicating the program to the parents. As a parent myself, we have so much information that gets thrown at us. Emptying out the book bag every night is somewhat overwhelming. So trying to figure out how to communicate what parent guidance is and what these resources are. I think that our school district did a great job at sharing that information as best as they could, in a way that parents would hopefully catch it and, actually read what it said. Also at events that we had at the school, the staff were out there sharing, had tables at different things, just doing their best to really get the word out. They did a live showing of one of the webinars, which, although there weren't a lot of families, we had a beautiful evening that night. There was some last minute just things that came up. It was still at least they heard about it again. They did a really good job at reminding parents. Some of the challenges, I think, for many things, people's time is a huge challenge. No matter what you're doing, it doesn't mean that if people aren't involved, it doesn't mean it's not important. It just means there are so many things out there for people to do, whether they're working 3 jobs or whether they have 3 other children. There's a lot happening. So trying to figure out in that moment what they can handle. I think no matter what you're in, people's time is going to always be a challenge. So, you just keep offering things and keep sharing, and do the best you can, I guess.
I know that the idea of people hearing about what's available right when they realize they need it is, I mean, that's a very difficult thing to do, but I know you've been able to share with some parents when they're talking about the struggles that they're having. You're like, hey, but do you know, you can do this thing. I know you feel strongly about dispelling the stigma around mental health and help seeking. And I know you also felt really strongly about experiencing these resources for yourself as a parent. What's the experience been like for you to experience parent guidance?
I think for me, it just so happens, it really just so happens that my daughter goes to the school that we're talking about. But just we do have some things going on with our daughter that we are trying to figure out, and learning about parent guidance and the fact that it's a great opportunity for parents to just kind of see if therapy or counseling is the next step for their child. Maybe it is, maybe it isn't. Parenting is hard, and it knowing that it was an opportunity for me to have some one-on-one time with a coach to just talk about things and kind of see, do we need to take that next step, or do we keep those appointments open for a family who really needs those services when they can be really difficult to get into? So, and also it's validating as well that, okay, you know what, I am doing an okay job, and it's been a good experience because I've learned a lot of things. um it also can work, it works with my schedule. So we're able to do it when I know that I have the time that I can commit to it. And even with that committed time, there's been times where I've had to, our daughter was sick or something came up, but we've been able to figure that out. And it's just a very nice conversation. Um, and she gives me resources. The next one that I have coming is just some information to hang on our fridge, just something as simple as that to help us through something that we're working on, things that I don't have to worry about. I don't have to go out and look for it. But there is homework, there is a commitment time as a parent, and but it also allows you to give yourself grace. And so I feel like it's been a really good experience for me. And I can bring resources to my partner too, who isn't always on the same level as I am as far as help for our daughter. So helps you navigate that too.
That's amazing. And one of the things that I love about this company is that they are willing to provide one-on-one coaching to anybody who's in any way connected to, like, anybody who's like grandparents or neighbors who babysit or whatever, so that everybody who cares about that one child can be on the same page. I love that. And thank you, Sarah, for talking a little bit about your experience. I think, I always, my kids are 19 and 21 now, but I could still use a coach. There are definitely things that I, as a parent, would love to talk over with somebody, and to have somebody do that work of saying, oh, here's a 3-minute video that you could access that would teach you this thing, this communication technique or whatever that you might want to use. So thank you so much. We really, really appreciate you being on the call and sharing your experience, Sarah.
Thank you for having me.
All right, I'm going to shift back over to our slide deck. And we're going to shift to talking about rural implementation. So we have 5, let's see, I have to do one more thing before I can do this. Give me just a second here. So our next speaker, unfortunately, has laryngitis as I clear my throat. But I wanted to talk with you a little bit about this rural implementation that we have going on. Across a 5-county area with 12 different school districts. And this implementation has brought into focus the broadband speed, data, device disparities that are often experienced in rural areas. So as we are working with families to connect them to mental health services, and as as even a motivation for adoption of broadband, we are also looking at all the barriers and difficulties that families in this community experience with regard to equal access and connectivity to not just mental health resources, but to the wealth of other things that we connect with through the internet. So we're going to talk a little bit about this rural implementation and our use of family resource developers in this community. Remember how I talked about the trusted messenger earlier? That is what we're going to connect with here. So Dr. Katie Bangs is over the Child and Adolescent Division at Egyptian Health Department in Southern Illinois that serves this 5-county area. I've asked Dr. Bangs if she could tell us a little bit about the 5-county area. And she mentions that there's Wayne, White, Saline, Gallatin, Hamilton counties. It's very rural with most of the diversity in the community surrounding around various diagnoses and poverty and trauma. There are 12 different school districts that Dr. Bangs works with across the 5-county area. And some of the districts have some folks from Egyptian Public Health Department in the schools doing different levels of service and integration. So the health department serves as the behavioral health partner, similar to what Dr. Toombs was mentioning about Catholic Charities. They're seeing a lot of needs across those 5 counties. They are using a social emotional screener in many of the districts and are finding a lot of emotional distress, particularly amongst middle schoolers. In some cases, the teachers fill out the screener on the students, and in other cases, the students fill them out themselves. But what they're seeing is that there are a lot of children in that tier 3 level that need a lot heavier, more intense and frequent work. Dr. Bangs oversees all the clinicians that are in those schools. And so the health department has a really nice connection to them. The biggest success so far, and Dr. Bangs, if you want to hop in on any of these, if you feel like you can, the biggest success you mentioned has been the partnership with the schools and by coming together with parent guidance. And the biggest challenge has been that in rural communities, there's what we call a hockey stick graph for implementation. So there's a long ramp. And then once something catches on, it really takes off. And that's been difficult for people who are not from the community to really understand that long on-ramp that you are comfortable with and you experience typically. Is there anything that you'd like to share about the implementation process and what it's been like for you and your team so far?
Yeah, so forgive me for my voice, guys. It's coming back slowly, but first of all, thank you for letting me join because this is a different conversation in the rural area. And so the rural and that long, slow trickle is very hard to get through, including even with schools, because when you're putting money towards something and it doesn't catch on, trying to get people to hang in there, because for us, it takes about 8 or 9 months before that snowball really takes off. And I've seen that across a lot of our programs that we've done with the health department. So I'm pretty comfortable with that. We're starting to see our trickle upward now with our implementation of parent guidance. And then I'm hoping our trickle will be a little bit faster with one of the platforms aimed at students directly next year. So that's to come. But I think that having the team approach and where we're meeting and kind of touching base kind of provides that cheerleading, and reviewing the data that we have so far has been so important in that, because as we get a few people, that kind of gives, that hope and that patience and that slow trickle to allow for the big snowball to start. So I think that's the biggest thing right now, and we're starting to have that increase. So I'm hoping it will continue, though we're coming across summer, so I don't know how that will impact us. But maybe we'll hit the ground running next school year.
I think one of the things that you've driven home for me is the importance of word of mouth. And that's why that idea of, having family resource developers not only be able to talk about family resource developers are people who have been hired largely because they have experience with the mental health system and potentially have had a child who they've navigated the mental health system and so on. And so the family resource developers being able to be familiar with the tools and talking to people, and then parents talking to each other once they've tried it, is I think a great strategy. And I'd like to shift and talk about this new implementation. So we've submitted a grant. If we get this grant, we will be implementing our first direct-to-student intervention. So this tool that Egyptian and its partners have chosen would be putting those tools in the hands of middle school and high school students. Would you like to say anything about sort of why you chose the vendor that you chose out of the side-by-side?
Well, we looked at a lot with your help and Terry's help, of course. So I think it was like the ease of the platform was one of the big things, and then just how open they were to having different consent processes and helping us partner with the schools on getting that consent process. That's going to be our most challenging hurdle in the rural community, especially because we have families that they don't have cars or transportation, and they live 45 minutes from the school. So trying to get a signature is not always feasible. So how are we going to get around those consent hurdles? We still unfortunately have a big mental health stigma too. So consenting to mental health services, even partnering with the schools, who are a trusted organization in the community, but mental health, maybe they don't think it should be in schools or should be talked about at all. So we still have some of those barriers in place. And we chose counselor because of just their openness to working with us and figuring out what is the best process for our community and communities, because each school might be a little bit different. So they're open to all those possibilities, which is really key for us because every community has its own small culture. So we have to keep that in mind when we partner with big platforms like this. And then as Egyptian, when we partner with schools too.
One of the things that's been great about partnering with the vendors being able to partner with you, Katie, at Egyptian, is that a bunch of schools that are small have been able to have access to these. And in some cases, that's been a barrier for small schools with only a few students because there are some fixed costs that make the tool too expensive. But in general, we've been able to budget, and I just should say and acknowledge that Egyptian Health Department has been able to fund the services that are going directly to the students through federal grants that you all have independently acquired. And for basically the cost of, like, I used to be a teacher, like the cost of the spelling workbook, we can bring a resource to every family in the school. It's really remarkable when we can bring together a number of students and resources. So this next slide, go ahead, Terry.
One more thing to add to that. Katie, because it is rural, the critical need for good broadband digital access, and in particular, you've identified, and this is a project that's hopefully to be sponsored by the Illinois Department of Commerce Economic Opportunity. But this fits squarely in this whole area of how can we get people to be aware and use digital resources. And as part of this project, you've designated your family development resources as digital navigators for the mental health. maybe you can just share how important those folks are in terms of influencing what goes on in those different schools.
Yeah, they're key for a lot of our successful programs. They are community members that have lived experience with navigating the IEP process, mental health services, maybe crisis services, and so they've been there. And people in these small communities know each other, and so these are people they grew up with, and so they feel comfortable talking to them and approaching them. And so by training our family resource developers and knowing what these are, when they talk to families or they have people approach them, they can kind of connect them to this platform and these resources, and kind of say, hey, there's this video on there. There's a topic on, maybe it's bullying, or maybe it's the parenting through anxiety and depression. Like, that parent that they're talking to has some mental health challenges they're working through, but they want to keep their children's needs at the forefront, kind of connecting them to that platform, and not only just telling them about it, but saying, hey, let me help you set it up on your phone, if they have one, because that's one of our challenges too that we've been working on, is who has actual digital tools that they can use. And the schools have been great with that they provide Chromebooks to the students. They're allowed to take those home, and parents can use them for this resource. So we have great success so far in that. But if we didn't have those people that were trusted in the communities, they would just kind of look the other way. To
Well,
be
and
honest.
that folds into one of the questions, and I realize we're at the end of our time, but this question that showed up, there's question sustainability for these things. What Brenda and I are doing, and the people that you've seen participating from schools, these are pilots, and we're identifying the best practices and how impactful and effective these can be. As the person who wrote the question in the Q&A knows, it's hard to get funding unless you can kind of prove the value proposition that it will be worth it. So in terms of sustainability, Brenda and I will do these type of presentations, but also we're assembling our results in terms of engagement, so that folks can get funding for these services. They ultimately end up touching more people, and we know this already from our preliminary results, at a lower cost. And again, it's tier 1, tier 2. So we're trying to prevent the escalation, but they impact more people at a lower cost. So there's value proposition there. It's just a matter of how to maximize the engagement on the part of the students in the case of this one here that you're seeing, or in the case of parents.
So speaking of funding, there are essential components there. We're not just funding the services themselves, but we have to fund the implementation, meaning that team, meaning those trusted messengers and so on. And then also that data collection and analysis. Those two other pieces often get forgotten. And so in addition to the services, in order for it to be successful, we have to budget and include for those as well. I'm noticing it's 1:30 on the dot, so I'm going to just move forward to post our email addresses here for anybody that wants to reach out to myself or to Terry. This has been wonderful to be together and update you all on where things are at with our implementations. If there are folks who have questions who want to stay on a little bit longer, I believe that that's possible. And I'm happy to stay on for a few minutes as well.
Yeah, we can stick around for a few minutes while we wrap up questions. Thank you so much for being here today, everyone. We really appreciate it. But yeah, you can take those questions now if you would like.
I don't see any questions popping up right now in the chat, so please reach out to myself or to Terry. Thank you again for the Upper Midwest Telehealth Resource Center. Thank you to Dr. Bangs, Principal Toombs, Sarah Winkle, and for Partnership for Connected Illinois.
Thank you so much, everybody. I'm going to go ahead and shut down the webinar unless there's anything else you'd like to address. Nope, not seeing anything else come in, so we will end it for today. Thank you again, guys, for being here. Always a pleasure.
Thank you all.